Hi, and welcome to Counseling Skills for Astrologers. I'm Vanessa Couto. I'm an astrological coach and artist here in Portland, Oregon. And one of my interests about this topic is because actually my background is in counseling psychology. But that was a sort of a long journey that I got from astrology into counseling psychology and then back to astrology again. So it's something that I have been very interested in, motivated in sort of studying and trying to understand. Now, I know that this topic is really big, counseling skills for astrologers. You couldn't possibly try to wrap this up in 1 hour. It's really something much longer. So I just hope that this presentation today is just sort of some food for thought, that it sort of brings in some questions and insights for your own practice and understanding on your own journey as an astrologer. And of course, through the comments that we can have it in the group to hear your own story, your own perspective. But to try to cram it all in an hour, I tried to bring in the topics that I found more relevant, that I have experienced in my own practice, in my own work. And just to start off is that, as astrologers, we're not just giving bits of information. It's much more than that. We are establishing a relationship with the client, even though often it's just a one-time or a single session. But nonetheless, there's a relationship that started. And also, the moment that the astrologer puts the client in touch with their chart, they're introducing the client to a relationship with the cosmos. I often tell my clients that, of course, in the single session, it's a bit like going to Italy. We're not going to see everything, but we're going to sort of try to just do a quick journey. And it's a way to have the client also be curious about the instrument of the birth chart. So in a way, we're establishing a relationship between us and the client, but between the client and the cosmos as well. And I have often found as well in my work that many clients come and they say, oh, I'm really interested in astrology. It's fascinating, but I really don't understand. I've had sessions before and it's all amazing, but I don't get it. And I think that's an interesting comment because in some ways, I have found that we are sort of a translator of the chart. Yes, we're translating, interpreting the symbols, the archetypes, but there's something more about that. Then I have found that it's not just giving that information. We're counseling, but not counseling. We don't want to give advice, but in some ways we're trying to bring the client to have a deeper relationship with those symbols. And often we have to be storytellers and be creative in how we interpret these symbols so it makes sense to the client and it makes sense to where they are at in their own journey. My interest in this has also been because of the fact that English is actually my second language. And so I've been fascinated with languages, and I taught languages for many years. I taught English and then I taught Portuguese. So this idea of the translation of symbols in the language is often on my mind when I'm working with a client. So I think that it's such a rich topic that could be a whole other presentation just by itself. So here's some questions that I would like you to sort of keep it in your mind during the presentation, afterwards think about it, and maybe put it in the comments what you think. What's your story with this? So why do we do what we do? Why do we decide to become astrologers or counseling astrologers or evolutionary astrologers? Why do we do this? And the other element is there are many forces that are present during the consultation. And let's just say that it's a very crowded room. And so in some ways, why do we do this? I have asked this question myself often on this journey of becoming an astrologer. And the deeper I go, it seems like the answer gets more profound, but I'm still finding the why I do what I do. So I would like to hear your opinion on why do you do this? So the first thing is the narcissistic wound of the helper. I feel like I've just jumped into the deep end with this. So when I was doing the counseling degree in counseling astrology, counseling psychology, we had to do our own therapy. It was part of the course that we had to undergo therapy. And that was a great thing because it helped us, prepared us to see clients. It prepared us to understand why we were doing what we were doing. And I think this is something that's not often talked about, not just in astrology or for astrologers. It's often not even talked about in any of the healing professions. I have met many other healers in different modalities, and I find that this is an issue that is sort of in the shadow, in the background, and it should be addressed in the education that any healing profession goes through. They should talk about this, that there's something deeper about why do we do it, and it's not just because we want to serve others and be of help. So the narcissistic wound means that we are injured by being deprived of the mirroring of that every child needs from the mother. And it's that mirroring that we take from our mother or our main caregiver, that instead of that main caregiver giving us what we need and mirroring to us that it's okay what we're feeling, what's coming up for us, instead of that, they expect the child or us to mirror their needs from the very beginning. So you see this in children, very young children, that they realize quickly if the mother or the father are very sad or very angry, they subdue their needs. They stop crying. And so in some ways, at a very young age, we are kind of trained to be helpers. So I'm not saying that everybody has this, but I think it's something that it could be explored further in our astrological education, because I have found that we receive great education on how to read the chart, on the symbols, but this is a topic that I think needs more attention in any astrology course or school, and of course for other healing professions as well. So in some ways, as a narcissistic wound of the helper, we become very sensitive to responding to others' feelings. This comes into the whole, we may be very empathic, our antenna is very sharp, we pick up what others are feeling, what they need, and we may tend to repress our own. So you can see this how it plays out already, but even before you have the consultation with the client, you can start seeing how this could play out. This could play out where astrologers may have a difficulty establishing boundaries for their sessions, extending too long, helping beyond what was negotiated because the client needs, and they know the client needs that help. Also, because of the sort of the situation with the family, we grow up to be trained to help. So it comes as second nature. We know that it's easier to go help the others. But the issue here, the deeper wound, is that it can be perceived that if we're not helping others, if we're not being empathic, if we're not being of constant support, then we will not receive love. And I think this is something we should be aware now, just in our own inner work. And it can become a deep wound with the helper that has many roots in how we develop our practice. Like I was saying before, it could become something of an issue around boundaries, an issue around how do we charge. And I think the money issue should be another topic to be discussed further. Or the way we engage in the conversation with the client. We can get burned out and all the sort of list of things that could happen. But so it's something to think about when you're reflecting on why do you do what you do. Is this something of your story, of your personal journey? Maybe it isn't, and that's great. But to just, think about it or your own experience with other helpers, with other healing professions. So why do we want to help people? So the theme of validation is really interesting because I have noticed, and often in some of my sessions with clients, that one of the number one things they will say is they feel validated. And for a long time, I thought, that was such an interesting realization, but I sort of stuck with that a little deeper. And going back to the narcissistic wound of the helper is the validation for our existence. when you're wounded in that way, it makes you feel like you have to constantly work to earn that right to exist. So it means we help beyond our self-care. That's another topic as well, the self-care for the helping professions. We give too much, we're overly generous, because in some ways unconsciously we think, oh, we need to be validated. I shouldn't be here, I need to work for it. Also the affirmation of the right to be what one is. So this could play very interesting. It could be in your own life. It could be also in the way the client experiences the session, the consultation. And I often found that the reason clients say, I feel validated, is almost as if, I get it. I understand now that I'm part of this cosmos. So it's a much bigger topic, but there's an affirmation. That's why we're here. That's why the birth chart says, I have permission to be. And back again to this idea that we have the right to be alive as we are. And so this is what we really see through the birth chart. Often clients will say, it's in the stars. They'll jokingly say, it's in the stars. But even though it's a joke, it's unconsciously, it's an affirmation to them that, it's okay. It's all right to be here. But we as the helpers also struggle with this, especially considering how astrology for so long has been portrayed as something that is still not seen doesn't fully receive its full respect as it used to. So in some ways, I think also there's the validation that we astrologers strive for as astrologers. It's much easier for somebody to go pay a lot more money for an attorney, but they may sort of dismiss or give the respect to an astrological consultation. It's not across the board, of course, it's getting better, but it's something that I think still plays out in the field. So going back to this idea of our own relationship and our own upbringing with our parents, the temptation that we may have to seek our parent in our patient. So Alice Miller was a psychotherapist, and at the end, I will have a slide with some of the suggestions of books around this topic. But she's the one who talked a lot about the gift of the wound of the gifted child, and she's the one who talks a lot about the narcissistic wound. And so that's why she refers to patients, but we can think of this as our clients. So we are seeing our parents in our clients. And think about, if you go back to your own relationship with your parents, I hope it was a good one and it was a healthy one, but often that might not be so. That often our parents did not listen to us with that much attention as our clients do, or reveal to us their inner world the way our clients can reveal to us. So behind sitting on the other side as the consulting astrologer, there's a lot of power in that position, a power that we may not have experienced when, as children with our parents. And so now, as the session goes, often an astrological session could be from an hour to 90 minutes. And so there's a lot already happening, and it goes way beyond just looking at the birth chart. So the unconscious comes through in every meeting we have. So especially when the individual comes to seek our help, already certain projections are set in motion. And these are both parental and archetypal. So when I was planning for this talk and setting up the slides, I actually wanted to tap into the archetypal aspects that sort of clients project onto us. But I figured we would not have enough time. That feels more like a topic that should just go by itself. But we should never underestimate the power of the parental projection that the clients already bring to us. And that already starts from how they see your website or how they first come in contact with you, the first communications they may have with you, if you're, exchanging emails back and forth or answering the phone. So in some ways, there's already a lot of unconscious energy working already, and you didn't even get to sit down yet for the client. So just some definitions that we get to probably use quite a bit, but sometimes may not really know what they mean. So this is just a really simplified version of these definitions. So transference, and these are all unconscious. We have this in every relationship we have, but especially when we are engaging with any healing modality, or we're the ones seeking help, or we're the ones helping, we should be aware that these three are always present in the consulting room. So transference are the feelings that the client transfers onto you. So perhaps you may remind them of their father or their mother or a distant aunt, and that will be significant. It could have been a good relationship, it could have been a difficult one, but that's already present. Now, the countertransference is what you experience in response to those feelings that the client already has projected onto you. They have transferred onto you. So perhaps something unconscious is being spoken to you. You feel a bit, maybe you feel all right, maybe you feel a little uneasy, and it triggers something in you as well, something in response to what is part of your life story that could be triggered. So maybe the client is the one who seems to you like he or she responds like your mother. Now, the projective identification is a trickier one, and maybe it might not happen during a 1-hour consultation in astrology, but if you're very sensitive to it, you would feel it, is when the client unconsciously makes you feel the same way as they do. And that's when you're all of a sudden you're in a session and all of a sudden you're feeling anxious. You don't know what's happening. You shouldn't be feeling anxious or sad. And the other interesting thing is often too, they will make you feel what they cannot bear to feel. So maybe they're the ones who are really angry, but you're the one feeling this anger rise within you, and you don't know why that it's there because you're not angry. So these are things that we could pay attention. And of course, as astrologers, we have a wonderful tool, which is the chart itself. So that already may help us know what is coming up. And it's a great tool, but we shouldn't dismiss how that affects us internally in our own, the bits within ourselves that need some healing. Now, I love this picture. Unfortunately, the resolution isn't that great, but it's the picture of Freud's couch. And some years ago, I went to his house in London and I got to see the couch. And it was interesting because it was actually rather small for, today's people's heights, but it was sort of the birth of psychotherapy in seeing that couch, the container where it all started. But beside the point of the couch here, there's something that he says it's very true, that it's amazing how the unconscious of one human being reacts upon the other. And it is all done underneath the radar of consciousness. So that's something really interesting that I'd love to hear your own stories in the comments of how has this experience affected your practice? Do you have any good stories to show and share about something that's unconscious that triggered you in your client work? I had one that happened to me, I think a couple of years ago. It had all revolved around boundaries, but I remember this client really triggered me, and to the point that I ended up I thought that the best way to deal with that was to refund her the money and cancel the consultation. But it really was about boundaries, and it taught me quite a few lessons about, it made me look at where are the leaks in my practice around boundaries of time and rescheduling. It seemed at first where it was just an annoyance, but there was something deeper that had really triggered me around my own wounding in regards to boundaries and generosity. So I think when clients really sort of hit us, and that doesn't have to be negative, but even in a very positive way, we should see what is happening, what's rising, what's the unspoken that is coming through. So back to that idea of the crowded room, right? So it's way more than just reading the birth chart. So when the client comes, even though they may be saying, oh, I want a session, I want a reading because I'm having career issues or marriage issues, there's also an unconscious agenda that's happening. It's not just what they say they want to focus on. But we as astrologers are also having an unconscious agenda. and we meet at that moment in time. So I think it's really important that we know when we, especially because we have the advantage of preparing for a session and looking at the charts to see and understand what is rising for us, and if we do have an agenda, because it's important to know and to be in integrity with that and honest with ourselves. If we do have an agenda for a session, it might not be the best thing that's for, for the client. And also all this energy is happening, as we mentioned just in the slide before, under the threshold of consciousness. So this is a key moment where all the stuff that we may have not dealt very well in our own birth charts, in our own life, in our own story, has a way of creeping into the session. And again, to that idea that especially if the client triggers us in any way, then it really is an invitation, and it behooves us to go deeper, looking into what is coming up. And of course, if we're always looking at our own birth chart and we're following our own transits, we may see, oh, I see, that's my whole Neptune issue walking right into my consultation room. Or it could be my difficulty with Saturn in my birth chart. So all those things, thankfully, we have astrology to help us have a language, an image, and a story to work through these things. While mom, dad, and the client and I are all in the counseling room. And so the idea of projection is very wide. But most importantly, I think it's the parental stuff that comes through and carries on through. When I was studying my counseling degree, the joke we had amongst ourselves in class was that we would always ask people, so tell me about your mother. And even though it was a joke, I have seen in my work how serious it actually is to dive deeper with the client around their parental stuff. Especially for whatever reason lately, I've been seeing a lot of mother stuff coming up. But, and it probably has to do with my own story, but it's interesting when you dive deeper and you're able to help the client see and work through those images, or at least get started on diving deeper. And the other thing I have noticed that not only do we meet our own parents in the course of our work, and of course, if we are not very conscious of this, we will tend to attract even more clients that bring about that projection. The other element I have noticed, as sort of a side note on this, is that when we're building our practice, starting our business, I have wondered if any issues we may have with our mothers, specifically our mothers, but also our fathers, if that sort of plays out in any challenges we may have in really birthing our business. That's sort of an idea that I've been playing around with, but I see the role of the parents as so deep and so rich. There's so much inner gold in there to be explored, so that we shouldn't let that just sort of slide. And then, of course, sometimes it's just a simple case that our charts are not compatible with the client's charts. So at least we have that language to help us reframe things. And back to the idea, I think I'm just really re-emphasizing it, that it behooves us to look under the hood. I'm a firm believer, and maybe that's from the counseling background, that we should keep doing our healing work. Be it via therapy, via other healing modalities. And in some ways, too, the projections we carry, ourselves and the clients are bringing into the consulting room, is that it creates it creates relationship patterns. We see this very well in our own sort of personal lives and out there in the world, but definitely in that sort of very powerful chemical vessel that is our consultation. And so if we have an unresolved complex that is still hurting, it's still there, we will try to get the other person to respond and behave in accordance to that energy complex. That could be for us, sort of the way we're seeing clients, and we may go through a phase where many clients come in with the same similar problems that are activating our complex, or we may definitely see how clients are relating to this in their own lives, how they are sort of taken by their own complex. And the other thing too, which is an amazing tool, especially if you're very intuitive, sensitive, empathic, is that all the feelings that this is Alice Miller, so the patient, but in this case you can think about the client, all the feelings that the client arouses in you is part of an unconscious attempt that the client has of telling you their story. And so they're kind of giving it to you. It reminds me a little bit of the work of Robert Johnson. He was a Jungian therapist, and he has a book called Inner Gold, where he talks about this idea that we often project our stuff onto somebody else. And of course, most of the time it's our shadow, the stuff we don't want to deal with. But it can also be the stuff that is our inner gold and we project onto somebody else. So many times the client will come to us and they think and they project onto us that we have the answers. We have this special connection with the heavens and we just know, and we will tell them. When in truth, I feel like it's our kind of job, if you will, to help them see that inner gold within themselves. So that's the gift that we can give them. And of course, the sturdier that our own psychic home is, the more courageous we are in exploring our inner work, the better astrologers we're going to be for our clients, for ourselves. So one story I had, and this is a sort of especially if you see clients more long-term, not just a single session. When I was doing my traineeship in counseling, I had a client who was, had a very challenging life and had already attempted suicide many times before I actually became her counselor. She had attempted suicide, I think, almost 10 times throughout her life. So it was very challenging story. And I remember when I started seeing her that I was, of course, very scared. I was like, oh my God, who am I to do this? But soon enough, I started having these thoughts that I wanted to quit the practice. I wanted to quit the grad program I was in. I just wanted to leave. And my clinical supervisor she called on to me. She said, ask yourself this question. Now, how big is your think about how big is your psyche, that was the language she used, to be able to hold this. And I was really that really struck me because it made me think, there's something here that is also about me, and I had to learn through this. And I think we can think this about our own selves. Well, of course, we know our chart, so we'll know what to look for. But how big is our psychic home to hold the problems and the issues that our clients are bringing in? And I think of course, what comes with this is we continue to do our inner work, however that is for you, whatever works best for you. We work on our early wounding. And also, most importantly, we keep on our self-care so we don't get burned out. But one thing that I did learn from that experience, another thing I learned from that experience, is something called vicarious trauma. And that is when, especially when you're dealing with people who have extreme trauma, you can start, and that has to do with the projection, you start feeling things they may have felt out of their trauma, and you hold their pain. Sometimes they cannot hold their sadness and their grief, and they project it onto you. So you start having some symptoms even related to the trauma. So in my case, in that situation, and I did a lot of inner work around that during that time with my therapist and my clinical supervisor, the same way that my client it was suicidal, I was experiencing that sort of quote unquote suicide as a way I wanted to leave things that I was very much engaged in doing. And so when I learned about vicarious trauma and how the way to counter with that is, do your inner work, but especially self-care, it got much better. I was able to hold the space for that client. So I still remember that quite a bit, especially now Granted, I don't have clients who come with such deep wounding, or that I could, I treated her for a year in that case, but self-care became sort of one of the number one things I have to tend to, so I can become, continue to hold the space for the client. And I just love this little cartoon from Snoopy. I did a little change with it. Instead of the psychiatric help, is the astrological help is here, the astrologers in. Hopefully it's not going to be just 5 cents. Maybe we can charge better prices than that. But when thinking about counseling skills for astrologers, is, of course, we're not teaching anybody how to be a counselor. We can teach some topics to watch out for, things to be attentive to. But really, I think what it would be interesting to see more and more in the counseling courses and in the, not the counseling courses, the astrology schools and courses, is that we help that sort of inner counselor of the astrology come through, so you can find your own way of being or knowing how to use your own sort of particular set of skills as a counselor with your clients. Everybody's going to be different, but there's sort of an inner counselor living inside you, and we can try to help you, sort of come out. And see, these are some of the books that I have read and sort of work with. And the Drama of the Gifted Child, that's by Alice Miller. It's a short little book, but very powerful. Astrological Counseling by Christina Rose. Counseling and Therapy Skills. This one is more sort of geared towards those in the counseling professions, but it has some really good tips as well. Power in the Helping Professions is a powerful book that I think anybody in the healing professions should read. He talks a lot about the shadow aspects of the healer. The Soul Speaks by Mark Jones, very good as well. And one of my favorites is The Astrologer, the Counselor, and the Priest by Liz Green and Julia Sharman Burke. Especially the section where Liz Green talks about the archetypes, the archetypal forces that come through during the counseling session, sort of the astrological session. I'm mixing the words here. But these are some books that I would recommend. If you already haven't seen them, check them out, see if you like it. And of course, this is me. I would like to thank you. I have my coloring book on Amazon. I have my podcast on iTunes. It's Liminal Astro Coaching. I like to weave psychology, depth psychology, storytelling, and astrology. And you can find more about me at vanessacouto.com. All right.
Great. Thank you so much, Vanessa.
You're welcome.
Would you like to take some questions or wind
Yeah,
down?
Sure.
Okay. Any questions from anybody?
Bring it on.
I have a question.
Okay.
Definitely have had experiences when I'm sitting with clients for astrology with that projection going on. And I did recently a holistic fair where I did like 30-minute readings. And at the very end, like 2 days straight of doing like 7 or 10 a day. So by the end, I'm wiped out. But the last guy who sat with me was one gentleman. And usually I have mostly women show up at these things, but it was a gentleman. And it was interesting. And it's probably part that I was so tired at the end of that thing. But I've never had such a powerful feeling come across, the table from this individual as I sat down and started kind of outlining his South Node and all of that and understanding his childhood and bringing that forward. And then I was just hit with this huge ball of emotion. Like I've never had that happen like that. Normally I might like just get glassy eyed a little bit and contain it and sit there. But this, I literally felt the urge to just completely bawl. Like
wow,
massively. And it was really powerful. And I profusely apologized for my inability to keep my emotions. But given his traumatic background, it was almost like it was being experienced for him. And his girlfriend is like, see, she's so good. Embarrassed a little bit, but at the same time, I was able to move through it and still be present with him. But I never felt that much at once. So when you were talking about the projection piece there and the transference, that's exactly, I think, because he was just kind of nodding his head and was like, oh wow, oh wow, oh wow. But it's not like he could emote himself, right? Like it was really powerful.
And how interesting that your story is really great, because for one, it was the last client, right? So after you had already 2 full days,
yeah,
where your psyche was really holding a lot, so your antenna was super sharp,
yeah,
but you were also already drained, so your defenses were down.
yeah, the boundaries.
The boundaries, I mean,
Yeah.
just the energetic boundaries for being there, right? All the energy exchange and all.
Yeah.
And this sounds to me too that it's probably something he couldn't hold himself, so he was projecting. You got to carry it for him.
Yeah.
Yeah.
I was acutely aware of that at the very end. It's like, yeah, I got a sense of that, because it was like the first, maybe he had verbalized his experiences to his girlfriend because she was, standing with him and very supportive. And, but it was like the emotional piece, I think that I brought that into the mix, and it was just kind of the right moment that because there was definitely an opening that was occurring in that moment, and I could feel it. And like you say, like we bring some of our own history into that mix and that's why I think we can be present, is we've done enough work to be able to contain and sit in that moment. But that was so profound for me, because I usually am pretty on with being able to contain it, like beyond, so that was really noticeable.
Noticeable, yeah. And I guess if I wonder too now, after doing 2 days full like that, what's your self-care around when there's such a strong energy exchange?
I'm usually fine after the end of the first day, but I'm very tired. So I make sure that I know this sounds odd, but I take a bath to absolutely like go into my Neptune or something. I have to have like completely like wash away the day and, just soak for an hour. And then then I go to bed. I go to bed early, eat a good meal, and then I go back out at the second day. And usually the second day, it's not as high energy, but it's still, I have enough to make it through. I don't think I could do it through 3 days in a row.
Yeah.
How fast you move through them. And for what I'm doing pretty deep in 30 minutes.
Yeah.
Which is not like what I shouldn't call it this, but I call it kind of the bubblegum astrology, which is just, you talk about transits and real fast and personality stuff, but I go deep and get right into it in 30 minutes. And I'm like, well, if you want more, here's my card.
And they're like, oh my God.
It does invite the conversation to be open. And if they want to go more, they can, but it does surprise people because they're probably expecting something more lighthearted.
Yeah. Yeah. When I used to see clients back to back, the only thing I could do, because I agree with you, I would take a bath, Epsom salts, just be calm. I took to really washing my hands thoroughly, just letting the water run on my hands.
Yeah.
Because at least that was, I could have the bath, but I could do that and it would help. And I learned that because of the whole vicarious trauma thing. I really had to pay attention how to be in my body during a session.
Well, there was one other thing that I did that helps me center is I have a Tibetan bowl, I guess that's what you call it, and I ring it and I, get the resonating, and I do that before my day and at the end of the day. So.
Yeah, and that's really good too. Yeah, I think we have to find our own sort of self-care rituals to help us, because we're dealing, if you think about it, we're dealing with our energy, the client's energy, and the sort of the cosmic stuff. So it's a very crowded room, and bring in the parents. Yeah, it's a busy thing.
It is. Great. Thank you so much.
Thank you for sharing your story.
Yeah.
Thanks, Sarah. Any final questions? Okay, so we'll wind down. Thank you so much, Vanessa.
Thank you.
Next time, and thanks from all of us.
Thank you.
Thank you. It was excellent. Thank you.
Thank you. That was really good.
Thank you.
Very good.